Good evening, everybody. On the occasion of National Plastic Surgery Day, which falls on the 15th of July, we are very happy to have with us Dr. G. Manokaran, consultant plastic surgeon at Apollo Hospitals, Greens Road, Chennai, who will be educating us about scars and all you need to know about cosmetic surgeries. A very warm welcome to our FB Live session, Doctor.
Good evening. Thank you very much for being part of the National Plastic Surgery Day celebrations which are going on in this institution. I am very glad to educate the common public on the issues of scar and the myths about cosmetic surgery.
We've received a couple of questions already, Doctor. Okay. So, what are scars?
Yeah, a scar is nothing but it's a healing process. If there is an injury, if there is a wound, if there is a burns, or if there is a incision for surgical procedure, that wound has to heal. So formation of collagen tissue in the dermis and epidermis, and then forming a new collagen and resurfacing is known as scar.
And what are the causes of scars?
Yeah, causage of the scar is, as I told you, there is a breach in the collagen in the epidermis, dermis, and subcutaneous, depending upon the depth of the scar. Usually, scars can be either a surgical scar or a post-injury scar or a post-burn scar. So these are the types of scar which is usually happens in any normal person. See, these scars can happen after even gunshot wounds. So all these comes under trauma. So we can either take it post-traumatic, post-incisional, post-burns, or post-surgical scar.
And how are scars generally treated?
A scar can be it can be treated in two ways. What we call it as primary healing or secondary wound healing. If it is primary wound healing, that means those incisions or injuries or those trauma can be sutured, and the edges can be brought together in a clean environment after doing a debridement if necessary, or a straight away suturing a scar and allowing it to heal is called scar healing by primary intention. If the scar is allowed to heal by doing dressing and everyday washing and then using dressing materials and allow it to heal, then it is called healing by secondary intention. So that means it has been allowed to heal from the periphery as well as from the bottom of the scar.
We have a question. I want to remove the mark of a blade cutting on my hand, which happened 5 years ago. Are there any ointments to remove them, or is surgery the only option?
Yeah, now in any scar for that matter, it is not necessary every scar needs a surgery. That is number one. Number two, we need to see, you need to see a doctor to decide whether that scar needs a surgical revision or it can be corrected by injecting the plasma or some of the chemical solutions available, or even sometimes very superficial scar can be lightened by using chemical creams which are available on the market. So those things can lighten the scar and it will be mostly invisible. So that is also possible. It depends upon the depth of the scar or types of the scar, like post-burn scar, hypertrophic scar, or keloidal scar. So it depends upon that. Very superficial, fine looking scar can be treated non-surgically.
Thank you, Doctor. We have a question. Does plastic surgery leave scars?
Yes, most of the people think plastic surgery means they will just mold it like a polished, so there won't be any scar. That is the common man's perception about plastic surgery. But the actual fact is, any incision which is made will produce a scar. But the scar produced by plastic surgeons will be placed in such a way that it will be camouflaged in the normal creases of the body, or it will be so fine that it will not be visible obviously, and it will be an invisible scar. That is why people go to plastic surgeons. So that is the most prime concern of a plastic surgeon. But unfortunately, some of the patients, maybe one in 100,000 patients, can develop a hypertrophic scar, can develop a keloid. But that we cannot find out initially. Some patients already have the history of hypertrophic scar or keloid. Then we can be very cautious about doing surgery in them, or the selecting the suture material, selecting this type of wound closure. So all these things matters.
Speaking of keloid, what is keloid, doctor?
Yeah, keloid is nothing but a benign growth which overgrow the border of the scar. For example, you make a surgical scar which is a vertical scar or a transverse scar. If there is a growth on that place which you over, so it is a three-dimensional growth of a collagen forming a benign tumor kind lesion in any scar going beyond the extent of the scar is called keloid.
We have a question. In what ways will life be different after surgical procedure?
And naturally, the most of the patients who come for scar revision to a plastic surgeon is basically they are obsessed with the scar. They think they can perform better if they don't have the scar. They think their confidence level will be much better if they don't have a scar. So most of them either they get depressed, or they think they are not able to perform in their chosen field because of the scar, which creates subconscious level of inferiority complex, that kind of thing. So to them, we need to counsel all the scar patients, just like because the patient is coming, we cannot operate on them. We need to know what is his mentality, what is his expectation after the surgery. So once you evaluate, so any scar patient need to be consulted, need to be counseled for 2-3 times before we take them for surgery, and actually know what exactly his expectations are. And you explain to them what are the realities of a plastic surgery. So if he is able to come to terms with that whatever thing which you have told, and he is able to agree, then he will be happy patient after doing surgery. Or without explaining all those things, if you operate on somebody and he imagines that there won't be any mark of surgery, then it will be a great disappointment. Even if the scar is much better or invisible, he will be keep on asking you, I thought I will not have a scar, I thought I will not have a scar. So first thing we need to tell the patient is, even plastic surgery will produce a scar, but the scar is either invisible or very light, or we place the scar in such a way that it goes into the normal creases in the body, like forehead or a nasolabial fold, or in the neck. You have some areas normal creases, no? To put it there, we plan in such a way. So this is the idea of plastic surgery in scar. So which has to be explained to the patient very well, and as I said, they have to be counseled.
Hello, doctor. I had an accident 3 years back and I got a cut on my nose in that accident. And as it was bleeding too much, I went to a nearby clinic immediately and they had put 3 stitches on my nose. Now, years after the surgery, the mark still remains. Can something be done?
Yes, of course, because it depends upon, as I said, the surgeon or the physician to whom you went. For an emergency, any qualified doctor can suture a wound, but the material they use may be different. So you may have a thick scar, or you may have a punctured scar, and all those things that can be revised by a plastic surgeon to make it in such a way that it is insignificantly obvious in your nose. This kind of thing, after doing a surgery, applying some kind of camouflaging makeup over that will definitely eliminate the presence of scar, though there is a scar. So you have to combine a scar revision and then a camouflaging technique and all those things. So that gives a better this thing, and the patient will be happy.
Hello, doctor. How are surgical scars removed, and can they be removed?
Yeah, surgical scar also can be removed, as I told you earlier. It depends upon the what type of surgery. In an emergency situation, they don't give much importance to the wound closure. And plastic surgery is one field which I wanted to tell you here, who handles the tissue very gently. So the handling, the scar formation starts from handling of the tissue to the final outcome. So all these things are emphasized in plastic surgery. So that is why a plastic surgeon sutured wound will look much better, much acceptable to a person, rather than going and getting it done in an emergency situation. So some people, if it is in a hidden area, they don't bother, but if it is obviously on the face or exposed areas, or on the hand or feet, whichever portion is exposed, then they would like to come to a plastic surgeon and get that scar revised. So any post-operative scar done for some other purpose can be revised by a plastic surgeon for a better looking scar.
Hello, doctor. I've been advised for a scar revision surgery. Is it necessary? Kindly advise.
As I told you earlier, the scar revision surgery is basically what the patient wants. Some people, they will have a scar, multiple scar on the face, but they will be keep going around with their work, so it doesn't bother. But some people, especially young adults, the scar bothers them much, and to have good social access, to carry themselves in a better position, they think that scar is a hindrance. So those kind of people, definitely it helps them if we do a better scar revision technique for them and helps them. So in that case, it is necessity. So the necessity depends upon what the patient wants. Some of the scars is not danger to anything. Scar is basically an aesthetic sense. So somebody wants to go for a beauty parlor to look better. So like that, somebody wants to a scar to be removed or make it better, they go to plastic surgery and get it done and make it better.
Is scar revision surgery painful?
No, it's all done under either local anesthesia or general anesthesia or regional anesthesia, depending upon the region where you have a scar or how big the scar is.
Hello, doctor. I'm 32 years old and I have chickenpox scars on my cheeks, which have been there for the last 10 years. Is there any way to treat it?
Yeah, of course, chicken box scar and all, it will be a round scar, so we can make it into a vertical scar, as though some surgery has been done, rather than making it a dark punctured type of scar. So it can be revised, it can be, but you cannot totally eliminate a scar.
Speaking about scars, what are the best scar removal treatments today, doctor?
Yeah, the best scar removal treatment depends upon, as I told you, the size of the scar, the place where it is there, and the depth of the scar. So depending upon that, if it is superficial, as I told you, it can be treated sometimes non-surgically. If it is deep, punctured, and in a very prominent place like nose, ear, forehead or on the face, then it needs a surgical revision in such a way that scar is placed in a normal crease or in such a way that it is insignificant, it is not seen obviously. Some of the scars, even if you take a photograph, it may not be visible. So to that level, scar revisions can be done. But scar revision can be done either by surgery or by people who are doing laser. But as far as I'm concerned, in India, not only in India, in any tropical country or in any country where there is pigmentation is very high on patients, the laser doesn't work that much. Laser is good only for people who are very fair, where their pigmentation level is very less. So they do better with laser rather than pigmented skin patients. Well, let it be Africa or let it be India, any tropical country with a high level of sun exposure and having a pigmentation, melanin pigmentation in their skin, are poor candidates for other techniques. Then, as I told you, this non-surgical applying, giving injections or applying some creams or go in for a surgical revision is better.
It's been 4 years after my surgery, and I've been advised a surgical, a revision surgery. I would like to know how long will the benefits of a procedure last?
No, once you get a good scar or once you get an acceptable fine scar, it lasts till your lifetime. There is no such time limit. As far as scar is concerned, sometime when the skin started sagging, in fact, it will be much better for the scar to hide in the sagging skin. So scar, once you get a good result, that lasts forever.
And what are the risks associated with scar surgeries, doctor? Scar revision surgeries?
Yeah, as I told you, there is no risk associated actually specifically for a scar surgery, because most of the scars are superficial, small in nature, and it is done under local anesthesia. Big scars like post-burn scars, contractures, and those kind of things has got overall complications of infection, skin loss, and things like that. Other than that, there is no major threat in scar revision surgery.
I have a burning mark on the left leg, and it's from my childhood, and I find it very uncomfortable, and I want to get rid of it. Can you please suggest?
Yeah, we can do a procedure called tissue expander, because first of all these scars need to be seen by a doctor, by a plastic surgeon, and it has to be evaluated what procedure will eliminate this scar as far as possible. So usually, from the way you are saying, these things may need another skin, which is a good skin quality there, rather than you have to take out that graft or that post-burn scar, and you have to bring in a good skin. So we use a tissue expander to expand the adjacent normal skin and bring that skin and use to cover this, and then take out the grafted skin or a burned skin out and use a normal skin. So these kind of tissue expanders, auto tissue expanders, those kind of things are available, and that will help you to do a good job in these things. In some of the areas, a big scar can be removed, and if they don't mind, we can take a small free flap and use that free flap also in that area, which gives a much better acceptance and much better compatibility to that area, and the donor area can be closed primarily. So these are the types of things. So we need to see the patient and evaluate which suits them the best.
What are the realistic expectations from a scar surgery?
What is the?
what are the realistic expectations that a patient should have from a scar surgery?
That's what, as I told you earlier, the patient should need a better scar or a less visible scar, or if there is something like an eyelid is hanging or a nose is twisted. So those kind of things can be corrected to the maximum level of normalcy, and without obvious deformity, a scar can be corrected. But they should not expect there should be not be any scar, so it will be like a mold. So that is not possible.
Are all plastic surgeries related to beauty?
No, that is another myth people are having. Plastic surgery means it is meant for only actress and very rich people. They only should undergo. So actually, plastic surgery in this world, India is the birthplace of plastic surgery. Susruta 600 BC in Varanasi, he started plastic surgery. But at that time, he didn't call it as plastic surgery, but the plastic surgery was born here. People those days, as a punishment, used to cut off their noses. So this nose has been reconstructed using a forehead flap, which was done in India in 600 BC. Imagine. So it is the birthplace for plastic surgery. So that was not done for any affluential people or just for beautification. Plastic surgery started as a reconstructive surgery. Then slowly, once the reconstructive part, then it has grown into multiple subspecialties like hand surgery, burn surgery, microvascular surgery, lymphology, and then cosmetic surgery. Like that, it has gone into various branches. And one of those branches is cosmetic surgery. What is the difference between a plastic surgery and cosmetic surgery? If you ask me, plastic surgery gives importance for function, restoring the function. Somebody has got a twisted hand, or somebody born with all fingers united together, or somebody born with a cleft lip and palate. So we do correction surgery. For that only plastic surgery started. As I said, plastic surgery is a reconstructive surgery first. Subsequently, once we started getting good results, apart from function, our concentration went into aesthetic sense. So, okay, we plastic surgeons should look into two things. One is a functional aspect, the other one is the aesthetic aspect. So, that aesthetic aspect alone coming into the place to play is called cosmetic surgery. What I am trying to tell in common man's terminology is, somebody with deformity, if we do some correction, then it is plastic surgery. Somebody no deformity wanted to augment what is normally already there, then if we do something to better it, then it is called cosmetic surgery. So that is the way it's going on.
And are there any side effects to this surgery?
No, if you go to a properly trained plastic surgeons, there should not be a problem in plastic surgery. As I told you, most of the plastic surgery done in otherwise normal human being, except trauma patient. Even in trauma, we have to stabilize the patient and look for other traumas like head injuries, orthopedic injuries and things like that. And then as a team, then we need to, even as a team, the much for the plastic surgeon to contribute, because the outside, ultimately the final outcome matters to the patient. What is done inside may not be known to the patient. What is he sees outside matters. So even in that way, even in the teamwork, the plastic surgeon has to play a great role.
I am a 27-year-old male from Chennai, and I got stuck by a tube light on my shoulder when I was 12 years old. I have since then got white scars on both my shoulders. These remain the same in size and color. What is this actually, and is there any treatment for this?
No, this depigmentation in a scar it is known, obviously, especially when the scar is knit. I don't know whether they have done a skin grafting. Their hypopigmented scar is known, or if the scar is very deep and allowed to heal by a secondary intention, as I said, without suturing or without skin grafting, then it can be white in color. So they need to see plastic surgeons and then evaluate and what is the best can be done. I'm sure something can be done for that gentleman.
What is generally the recovery time for these scar surgeries?
There is no particular time. It all depends upon, as I told you, it's a need based. Even a small boy may refuse to go to classes if he has got a very bad scar on the face. So he would like to get it done as early as possible, because many parents have brought small children, either girl or boy, that they have a scar on the forehead or on the nose. They are refusing to go to class, so we need to do so. It is like that. Sometimes when before they get married, they would like to look better, they would like to revise their scar, and at that time, by then, if they started earning by themselves, then they can afford to spend for themselves. So these are the actually the common indications. Other than that, there is no specific thing to say that this is the ideal time to get a scar repaired.
Speaking of patients and treatment, what are the myths that are associated with the field in the field of plastic surgery, doctor?
As I told you, many people think plastic surgery means it is a beautification surgery. It is not so. Plastic surgery helps for all the people, irrespective of their social strata, irrespective of the work, because plastic surgery basically, as I told, is a reconstructive surgery. Plastic surgery developed in a big way during the World War I and II, because lot of facial-maxillary gunshot wounds, and then lot of limb losses, lot of burn patients during World War. All these patients needed resurfacing or scar revisions or reconstruction. That is how plastic surgery came into the world in a big way. So it is first of all a reconstructive surgery, then comes the cosmetic, as I said, the aesthetic aspect. So I request the viewer to think that plastic surgery is a functional surgery with a good aesthetic result.
Who should avoid undergoing scar surgeries or cosmetic surgeries?
Who should?
Avoid undergoing cosmetic surgeries or scar surgeries.
Yeah, that is what, as I told you earlier, these patients has to be counseled. So when you are counseling itself, you will understand whether this fellow or this person will get satisfied if you do a scar revision on them. So if you think that his mentality or his attitude doesn't suit, that he is going to accept any even least size or shape of the scar, then those patients, it is better to avoid those patients to go for a go under knife. So that is one patient. Then other issues like mentally retarded and things like that, I don't think they are ideal candidates. As I said, this doesn't contribute much to the function, this being mostly for aesthetic purpose, for looking better. So we need to analyze the patient and their expectation and plan. If you think that that patient will be a troublesome patient, it's better to avoid such patients.
Hello, doctor. I'm 37 years old, female from Chennai, and 9 months before I got second-degree burns, but I still have the scars. Is it safe to go for swimming?
They can, if it is already healed, they can go for a swimming. That is not a problem. Usually anything which is, if a first degree or a superficial burn can be allowed to heal by primary intention, it will heal, epithelialize normally, and then sometimes they won't even have a scar. But second degree burns and third degree burns, it's better to go for surgery early and have a better aesthetic results. But just because you have a burn scar, if it is already healed well, consolidated, you can go for any exercise, swimming, or you can carry out your regular work.
Following that question, are there any lifestyle modification or changes that needs to be made post surgery?
I don't think for scar surgery there is any need for a lifestyle change. For reconstructive surgery, maybe yes, it depends upon where we reconstruct. And there are some do's and don'ts for these patients, which we advise them what to do and what are the things to be avoided. So that cannot be categorically said. It varies from individual case to case, and it depends upon where we have done the surgery. So depending upon that, we always advise them the do's and don'ts. So if they follow that, that is the slight modification in their lifestyle.
15th July being National Plastic Surgery Day, would you like to share your thoughts with our viewers?
Yeah, first of all, I would like to thank all the people concerned, our management and you people, for having given me this opportunity to talk to the viewers, to talk about and to tell them about the myth about plastic surgery, to demystify the plastic surgical issues. So I would like to thank. And my concern is, people should not think plastic surgery is a field which is meant for elite. That is wrong. That is number one I wanted to tell. Number two, plastic surgery will not produce a scar. It can change person to person. That perception also must change. Plastic surgery also will produce a scar, but it is an acceptable scar. See, now even face transplant has come, hand transplant has come. So we can transplant all those things. In that face, you may not have a scar, but it is not your face. But on the face where we have united that, we will try to unite as far as possible on the hair bearing area, so that when you look at the face, it is a new face, but you look differently, but there is no scar there. But wherever we have united that to your other tissues, there will be a scar. Like that only even in hand transplant. But we have come a long way, as I said, from 600 BC till now in plastic surgery. But I hope still we will be able to grow further, and maybe a day will come, the reality of the general public, that plastic surgery will not have a scar, may come through also.
Thank you, Doctor. That was a very informative session. For appointments with Dr. Manokaran, please connect at 97100-92401. I repeat, 97100-92401. Thank you, Doctor. Thank you, viewers.